Can you hear me fine? I'm hoping. Good. I tend to overwhelm microphones, so if I do, just tell me and I'll drop this thing down a little bit. Thank you for coming together this morning for our NeoMed biweekly update. It's really nice to be able to do this in a hybrid model now where we are in person, although I understand we have people on Zoom also who can interject and ask questions. Remind everybody that there is coffee and there's coffee and cookies out front. If you would like some, please enjoy. It's not a bribe, it's incentive. It's actually bringing everybody together. And Michelle Mulhern just let me know that as a way to recognize we're back in person, there are 3 door prizes that she's going to be managing for this group. I don't think any is a trip to Bora Bora, but I'm sure they're still interesting. Thank you. It's really meaningful to get together in person. You heard all the chatter going on. It's wonderful to be able to hear that. I'm going to just cover a few topics and open it up for questions after that. But I do want to start by recognizing our really talented faculty here. It's such a privilege every time we do this to recognize those who are getting external funding, which is acknowledgement of the work that they're doing and the impact of that work. And you hear me talk about it at each of these, which means we have a lot of it taking place, which means we have a really powerful and talented group of faculty here. I'm going to recognize 5 this time who've received grants in the last 2 weeks that I've been aware of. It's Dr. Kang, Dr. Kazimov, Dr. Safadi, Dr. Hupp, and Dr. Rauda. I've been told I've been pronouncing Dr. Rauda's name incorrectly all along, but great credit to her. She's continuing to get recognition for all the grants that she brings into this institution for her work. So thank you to all of you for the great work that you do here. It's been a really wonderful couple of weeks being back in person. We've started our College of Medicine first and second years. We had our orientation for the new College of Medicine students. I talked to all of you in the updates that we provided in June that we thought we were really making progress in making this an appropriately diverse campus with our students. And I'm really pleased to say that the College of Medicine first year class is formally at 30% underrepresented minorities, not underrepresented in medicine, which is the term that most use to say, let's buffer our numbers up by saying we're including other types of people. But this is the number that we're really paying attention to. So hats off to all of you who made this happen. We've also had our white coat ceremony, which was quite successful. And in a few weeks, we'll be welcoming the new College of Pharmacy students here. They start on the 17th of August, and they will have their white coat ceremony on the 20th. I also want to encourage all of you to come to campus on the at the new center on the 12th in the evening. You should be getting, and you'll get more invitations to Neovations. It's a program that Dr. Safadi's been taking charge of, and it's bringing students together from across the region at different universities, working with clinicians and scientists to create new solutions to medical problems that can be potentially patented and commercialized to have great impact on healthcare. So thank you, Dr. Safadi, for helping run that program. And I know it's more than just you. You've got a team working with you, but I do thank everybody who's been involved in that. I do want to talk a lot about COVID again. So all of us have been abiding by the COVID rules on campus. I really thank you for doing that. I'm pleased to say that our faculty and staff are at 90% vaccination rate. Our College of Medicine students are at 97% as a whole. College of Pharmacy students are at about 87%, but mostly they're not back yet. So we're looking for those numbers also to increase. Either way you look at it, overall, our campus is above 90% as a whole, and no other university in the state can boast that. We are head and shoulders above everybody else, which just makes us a very, very safe campus. And it shows that all of us, our students, our faculty and staff, are doing what's right for yourselves as well as for your families and for our community. So thank you all. We do recognize that there are some people who can't take the vaccine for religious reasons, for medical reasons. So we do support them also. I know we'll never get to 100%, We may by default, if those individuals who are unvaccinated get COVID-19, then at least for a time period, which is really to be determined, we know that they have become vaccinated through infection. So we are in a really good spot on this campus. All of you know that the policies that we put in place and are constantly evolving and have been over the course of the pandemic are the choice program. Get vaccinated, this is university policy, get vaccinated and show it. And you don't have to follow any special rules, and we're not going to implement the mandatory COVID-19 testing weekly that the governor has really pushed us to do so that we can understand as a state where we are. And then if you choose not to, and again, it's a choice program, we're gonna have you face cover, we're gonna do weekly testing. For our faculty and staff, that's 20%. For the students, that'll be 100% of unvaccinated tested every week. And that's just so we know where we're at. With the vaccinated folks, we know you're vaccinated. For those who aren't, we want to understand where you're at without the vaccine so that we can determine whether you shouldn't be here on campus. And it's really about your safety, and it's about the safety of the individuals on the campus who can't get vaccinated. We know the data is always variable, but on average, about 99% of all the individuals now, even with the Delta variant, who are being hospitalized or dying are unvaccinated. So we do need to look out for that crowd. That's part of the reason we're implementing this process. I've also told the deans that they can be more restrictive than university policy, but not less restrictive than university policy. So that applies to students, right? Faculty and staff are university employees, but it does apply to the area where those students are. And so we ask you to abide by those too. So if one of the colleges decides that in order to fulfill its mission and bring in a professor who may be uncomfortable, if they mandate vaccine wearing, I think it's going to be tough with a mandate, but if they do with students, then we ask faculty and staff who are in that classroom, if this were the classroom, that you please also abide by the policies that they put in place. But right now we are not mandating any changes. We do know that there's a lot of data coming out, and this is constantly evolving. There's the CDC recommendation that you wear face coverings indoors if you're in a really high-risk area. Well, Summit County is listed as moderate. Portage is listed as substantial right now. But that data is really based on a mostly unvaccinated population. We are a mostly vaccinated population. So at this point, we're saying the choice program is in place. The colleges can be more restrictive in the educational environment for their students. And this could all change rapidly depending on what happens. But vaccinated individuals, you might get some symptoms. We know that. We've always known that. But the chances of you getting really sick or really, God forbid, dying from it are incredibly small, probably much closer or even lower than it would be for the flu virus. But the data is constantly evolving. So please bear with us. If there are changes that are going to occur, as they've happened throughout this pandemic, mostly they're coming from the governor of the state, the legislature in the state, or it's going to be coming to us from the CDC, which are currently guidelines, but we do have to follow federal and state law. Moving on to a better topic, the university is now at 48 years of existence as of November. We're going to be celebrating a 50th anniversary in 2 years, and that's going to come upon us very, very quickly. And I want to give you a little bit to think about. When you come to work every day, how do you feel about what it is you do and the impact you have on our community? And I'm not sure we ever do a very good job telling that story. We have incredible leaders who've graduated from this university, and that's a reflection of the quality of the education and of the mentorship that they get while they're here at Northeast Ohio Medical University. A little less than half of those are spread throughout the country. We have individuals who've just been groundbreaking, like Dr. Frank Pape, who was part of the very first full face transplant that was done on a patient in Cleveland Clinic. I mean, just stellar examples. And I can list many, right? We don't have time to go through all of the great examples. But if you really distill it down to more than that, what impact do you have in your jobs and have we had as a university on Ohio? More than 50% of our College of Medicine graduates have stayed in Ohio and are practicing in Ohio. What does that mean? If you take the total population of doctors in the state of Ohio and you say, let's just look at American graduates who hold an MD, that's almost 1 in 10 doctors in this state are from Neomed, have trained at Neomed. So when the state started us up and you look at what is the impact that we have had, that's really pretty tremendous. If you go out, especially in Northeast Ohio, the chances are your doctor is a Neomed doctor. What does that translate into? If we look at the numbers, the data says the average doctor sees about 20 patients a day. And if we bring it down, because we know they work more than this, and say they work 5 days a week and maybe they take a couple of weeks of vacation, that means our physicians at any one time in Ohio are providing over 10 million patient visits per year. 10 million. Population of the state is 11.7 million. That is phenomenal. That's part of what you have done being at this university, coming together, and the impact that we have. College of Pharmacy has been here a whole lot less time than the College of Medicine. Roughly 2007, they needed 4 years to graduate their first class. There are now 750 graduates, about 90% of them stay and practice in Ohio. In fact, it's a little bit higher than 90%. The data says the average pharmacist will actually fill 259 prescriptions per day. If you look at that, how many prescriptions per day are our pharmacists filling in the state of Ohio, averaged out over the year? I did the math last night. It's about 39 million prescriptions in Ohio coming from our graduates. Aside from all the other great work that they do, the groundbreaking research from our PhD graduates, the masters who are coming out of here, if you look at the overall impact of this university, it's astounding. And it's because of you. So I heard a comment from somebody outside the university said, oh, Neomed, it's like that truck stop off of 44. We're not a truck stop off of 44. Our numbers are superior to nearly every other university in the state of Ohio in healthcare. We drive true impact, and it's you. It's our professors that teach. It's our curriculum coordinators. It's our student experiential leaders. It's the police officers who keep this campus such an incredibly safe place. It's the ops team that makes this place look so beautiful. If you go to any other campus, I dare you to compare the quality of the grounds to ours. So this is an amazing team of individuals, and all of you are the reason that we have the impact that we have. So I want you to think about that. The pandemic has really brought morale down at every institution nationally. That in fact, almost every organization is battling with how do we deal with the depression and the unhappiness of the employees who work for them. Many can't hire employees. They lose them constantly. We've been very fortunate. Nearly every job we post, it's filled and gets filled by highly qualified people very quickly. We don't really have a high attrition rate. That tells me that this is a great place to be. But all of us are down because of the pandemic. And this is an interesting time for us to work really hard to improve the quality of life on this campus, to make changes to compensation, to make changes to benefits, to give you more time that's flexible so that you can work from home. We've really done our best to implement a lot of new programs, but how do we measure whether we're having impact at a time when people are really down, really depressed, trying to figure out how we survive during this pandemic time that's taking place? And I think all of us thought would be over with right now. We're at 16, 17 months into this and not quite sure when it's going to end. So I'm reaching out to all of you continuously, and I ask you to continue to give input. What is it we do to make this place a better place for you? And think about the quality of life that you have here, relative to what it might be someplace else so that we can really focus on our employees and our students and making this a really great place to be. And we don't have a really good measure of that. What I hear a lot is morale's down, everybody's really unhappy, but we're filling our doors with great people and they're not leaving. So I hope we're doing something right. And I ask you to please focus on the things we're doing right so that we know we're doing them right, we continue them, and what we can do to improve. And I really want to make this a place it's outstanding for everybody, because the results of this institution that I just shared are really quite amazing. So with that, I'm going to stop and just open it up for questions. I do want to start with the in-person group first, and then as questions come up on the screen, and I'm going to have to pull out the old guy glasses to read, I will answer those next. So anything here, this group? Dr. Moed, and I'm just figured out Dr. Rauda's name, and I know I mispronounce yours every time.
That's right.
Perfect, good.
It's anglicized over the years, but that's right.
Do you need a mic? Does he need a mic? You need
Yeah,
a
the
mic.
mics are in the wings, so you
Okay,
do have to
sure.
go.
Just because we have people online.
Yeah. So not a question, but a comment, and I think for the folks who think the morale issues and depression, anxiety, all those things that are up are limited to a particular segment. They're not, they're really universal. So thank you for contextualizing that. I found a personal cure last week, and Sandra would probably echo this. Anything you can do to connect with our student body is going to make you feel a whole lot better about why you're here, because I got to spend most of the week with them last week and they're amazing.
I think that's a great comment. Thank you. Yes, we applaud that comment. We are here first and foremost for the students, and they really are a joy and a delight to be around. Other questions? No, really? None? Well, let's take a look and see what we have here. With all the focus making processes faster and more efficient, now making research more commercial, not sure that's true, is Neomed leadership anticipating that anything will be lost? Creative thinking to solve big complex problems can always be formulated in a step-by-step process. And it seems to some of us that many of higher education's administrative problems and biomedicine's research challenges require open-ended brainstorming in contradiction with Lean Six Sigma principles. I can speak for Sarah Brickley to say that's not true of Lean. There's an application of Lean processes to make sure we're not wasting resources. It often requires brainstorming and looking at others, being innovative and creative in what we do in our approaches, and not implementing simple changes. They're very, very complex changes at times, but being smart about it. And if everything were fixable with an easy solution of 5 people getting together in a boardroom and saying, here's what we're going to do, we'd be in wonderful shape, but we know that's not really the case. So I'm going to disagree a little bit, and I hope that that's not a general perception. Lean is a different way of thinking, but ultimately, if you look at Lean and what it was meant to be, it was started by Toyota, in fact, around World War II, post-World War II period, and it was about perfect customer value. It wasn't about cutting costs. It was about how do we deliver perfect customer value. So if you are required to do something at an institution that's really not valuable to you or the institution, and yet we say, oh, you have to do this, which is very frequent at places, that's a waste of your time. It's a waste of our time. We should be giving it back to you. That's the low-hanging fruit. But ultimately, value is measured in the eyes of the customers. And we have many customers. I know people don't always like the customer term, but our faculty are our customers. Our staff are our customers. Our students are all of the customers to all of us. So we focus on making everything as good as we can. Lean would say you can never achieve perfect customer value. You're always on a journey to get there and to do a better job. And I hope there's also not a general perception that research is all focused on commercialization. That shouldn't be true. If you can commercialize something, great. It may bring money back to the university to fund our mission set. But you can't always commercialize things, and not all research is meant to be commercial. We have to build on the foundations that we have. And sometimes your work as a researcher, the value of it may not be seen for a generation or two, and then it gets picked up very, very quickly. I had this discussion this last weekend with one of our one of our research partners here. You think about Mendelian genetics, for those of you who are in science in the room. Gregor Mendel and the work that he did that was so groundbreaking was completed, and he didn't get credit for it until after he was dead, right? So but it was transformative. Sometimes you don't know where research is going to go. It doesn't have to be commercialized. Gregor Mendel certainly didn't commercialize the work that he did with peas. And then we don't really talk about the work he did with bees that created some really vicious bees that were a problem. But he just did the work for the basis of science. And you don't know where things are going until later on. So measuring the value early on is very difficult. There were more questions, but now it says no more questions.
They were answered.
Oh, they were answered. Thank you. Anything else? We've still got time. Well, if there isn't, then I'm going to ask that you please feel free to spend some time talking to each other, having some coffee. We got a bunch of cookies out there that need to get eaten. And Michelle wants to do some door prizes. It's just wonderful to get everybody together again and see everybody in the room. So thank you for your time this morning.